The Free State Department of Health is part of the National Vooma Vaccination Week for the period of 3rd to the 10th of December 2021. During this period, all districts have been asked to increase the number of vaccination sites, especially in travel hubs, shopping malls and recreational areas, increasing availability to people. Let's get an update on how the program has been running. And we're joined by Free State MEC for Health Montseng Tsiu. Mam Tsiu, very good afternoon. Good to speak to you. Now, you're the first province to cross the 50% threshold in adults being vaccinated. Walk us through how you've achieved this amount of success.
What we did was, when we noticed that fewer people were coming to what we had established as our vaccine sites. We then call them our traditional vaccine sites. Most of them were within our institutions, like in the hospitals, universities, Manapo, Disabeng, and all that. When we noticed that fewer people were now coming, we thought then the problem might not be the hesitancy, but should be the accessibility, because some people would not have money to come to where the vaccine sites are. So we started going to the communities, establishing the pop-up sites, vaccine sites, closer to where the people are living, so in the streets, and then we would ask our community healthcare workers to go knock in the people's doors so that people can come and we are near them. That is what we are doing, and then that is really working for us. It is working well, very well for us. I mean.
Now, talk to us about this Vooma drive that's carrying on this week, and in fact, running between the 3rd, which is yesterday, all the way through to the 10th of December. What successes have you enjoyed this weekend?
We had planned well this weekend, and because we targeted places where we know that we have seen, we made an assessment and could see that in a certain section of Botshabelo, or section G, people there are not vaccinated. Very few people are vaccinated. We are at around 33% or so. So we moved our pop-up sites there. But the unfortunate thing is that it's raining heavily in Bloemfontein today, even in Botshabelo. So even though we went with our mobile to try and get the people, they are coming, though they're not in the numbers that we had expected.
Okay, so I can imagine that this weekend, those targets that you've set for yourselves will be difficult to achieve.
They are difficult to achieve, but as we were there, we then decided that we would continue even during the week. The teams that we have sent there, they should remain there for a week at least.
Mam Tsiu, one of the things that we are all too familiar with is that there are many individuals that are sitting on the fence, if you will, of should I or should I not get vaccinated. Now, what advocacy, if any, are you doing to convince those people that are sitting on the fence to get the jab?
What we do is that we even our community healthcare workers, who are the people that we send into the people's houses, we tell them to tell the people that they should weigh the options, especially when it comes to vaccine. That if you are not vaccinated, you are liable to get a severe illness and may be admitted or may even die. But if you are vaccinated, you know for sure that you are covered. You may get infected, yes, but you won't get severe illness, and there will not be any need for you to be admitted. So people should then weigh those and see which one is better for you to go for. And that thing is working, because we really show the people, look, we talk about something that has happened during the time when the healthcare workers got vaccine, just immediately after the first wave. Once they got vaccine, few of them got admitted, or even fewer of them died, in fact, or if close to zero that died. Most of our healthcare workers died during the first time when we had no vaccine at all.
So would you say that trusting an individual that comes to you and advocates that you get the vaccine is an integral part to convincing some of these fence sitters?
Yes, that's what we should do. We do listen to them, and we discuss even as they come. Some will just say, come sit down with us here at our vaccine site and try and discuss and find out what are their fears, and we address those fears. Others will tell you about the side effects, but then you tell them, look, the side effects last 1, 2, 3 days, but then after that you are fine. But if you get the illness, you get infected, you are sick for months or may even die. So you can't risk dying at the fear of just being sick for 2 to 3 days.
Now, how many sites are you working with in this province?
We actually have about 65 sites that we have opened for this weekend, because we wanted to get as many people as possible throughout our 5 districts. We had really gone out in numbers this weekend. It's unfortunate the weather is not agreeing with us, but what we are going to do is to work, like I said, make sure that we remain with the teams and the sites for a week.
Now, COVID is not about government, it's about you and I, it's about all of us. Is government working with other establishments, with the private sector, for instance, in this Vooma drive that's going on this weekend and beyond?
Yes, we are working with other private sectors. In the higher institutions, the University of Free State has allowed us to open a site at the institution itself. Though it has stopped now that the schools are closing, but we were going to go back there again during January when the students are opening. And Solidarity Fund is also helping us. There are the other sites that are managed with them. We also have WHO helping us here. They are working with us in managing the vaccine and also in trying to trace those people that have been infected, their contacts and all that. We have other private NGOs that help us in making sure that we work with this vaccine. We're not just working alone as government.
Tsiu, you raised the issue of institutions of higher learning, these tertiary institutions, and we know that a couple have said that they're going to insist on vaccination being mandatory. What is your take on the prospects of the mandatory vaccination policy?
I think as the Department of Health, we should meet with the student bodies representatives to try and discuss and get to maybe a sort of an agreement or getting the vaccine mandatory. We understand that the Constitution of South Africa said everybody must, you've got the rights that we must respect and all that, even the human rights that we must respect. But however, this time around, we're talking about the protection of the lives of the people. Everybody, when I vaccinate, I don't just protect myself, but I protect other people as well. So we should try and think about the advantages of having herd immunity of the community rather than individual immunity. So we should work on that. That is why then would ultimately then agree on the policy that would say the vaccine should be mandatory. I believe that it should be mandatory, but I know that if we force it, it may not be a good thing. We need to agree. We need to sit down and agree on that.
Now, we've seen a surge in the COVID numbers in the last few days. In your province, is this attributable to Omicron, or are you unable to discern at this point what has led to an increase in those numbers?
We also have the variant in our province, but we also have, though they are not in bigger numbers as compared to other provinces, but that is also a cause for concern for us, because only 2 weeks ago we had about, in our biggest hospital, 2 COVID-19 patients, but yesterday as I checked, they said they had admitted 8 of those patients. Even though they've admitted 8, we had in the past 24 hours, we had 251 positive cases, which was a lot because, like I said, in the past 2 weeks, we were seeing about 8, 5, 6, 7 patients. Patients that would have tested positive in 24 hours. But now we have jumped to more than 200, which is a concern to us.
Now, finally, ma'am, before we let you go, you've obviously achieved that 50% threshold of vaccinated adults. Are you sharing this experience or your ability to get to those numbers with your colleagues in other provinces? Because obviously we do meet as health MECs, and we share the experiences, even with the issue of the hesitancy. We have seen that most of the time the hesitancy may be in metropolitans like we have in Bloemfontein, but when you go to the rural areas, there's no hesitancy. People need the vaccine.
it's us, the department, that must make sure that we make the vaccine accessible to the people.
Tsiu, I appreciate your time this afternoon. Montseng Tsiu, MEC of Health in the Free State, chatting to us about the numbers that they've been able to achieve and, in fact, the work that they're doing over this weekend, the Vooma Drive weekend.